suicide. The word itself sends shivers down our spines, forcing us to confront a stark and uncomfortable reality of our existence. It is a tragedy that leaves behind a trail of devastation, impacting families, communities, and societies at large. Each year, countless lives are lost to suicide, making it a pressing global health crisis demanding our attention. The World Health Organization estimates that nearly 800,000 people die by suicide every year, translating to one death every 40 seconds. These figures are staggering, underlining the urgency to understand, address, and prevent this devastating phenomenon. Suicide is a complex issue, often stemming from a multitude of factors that intertwine and contribute to a person's decision to end their life. It is rarely, if ever, caused by a single event or reason. Instead, it is often the culmination of various biological, psychological, social, and environmental influences that converge, creating a perfect storm of despair. This intricate web of factors makes understanding suicide challenging, yet it is a challenge we must confront head-on. The purpose of this essay is to delve into the multifaceted world of suicide, exploring its causes, risk factors, and prevention strategies. We will navigate through the intricate labyrinth of genetic predispositions, environmental triggers, and mental health conditions that can contribute to suicidal ideation. By understanding these factors, we can begin to dismantle the stigma surrounding suicide and create a more compassionate and supportive environment for those who are struggling. This exploration is not for the faint of heart. It requires empathy, understanding, and a willingness to confront uncomfortable truths. However, it is a journey we must undertake to shed light on this often misunderstood issue and move towards a future where suicide is no longer a tragic reality. The roots of suicide, while complex and multifaceted, often find their origins in the very blueprint of our being, our genes. While not a guaranteed predictor, family history of suicide and mental health conditions can significantly elevate an individual's risk. Studies have shown that individuals with a family history of suicide are more likely to attempt or die by suicide themselves. This suggests a hereditary component to suicidal behavior, pointing towards a genetic susceptibility that can be passed down through generations. This genetic predisposition, however, is not a deterministic life sentence. Just as genes can influence our physical characteristics, they also play a role in shaping our mental and emotional landscape. While some individuals may inherit a genetic vulnerability to mental health conditions like depression or bipolar disorder, which can increase suicide risk, it is crucial to remember that genes are not destiny. Environmental factors, life experiences, and personal choices also play a significant role in shaping an individual's mental health trajectory. Just because someone has a family history of suicide or mental illness does not mean they are destined to follow the same path. Early intervention, mental health support, and a nurturing environment can mitigate genetic risks and foster resilience. Understanding the role of genetics is not about predicting who will or will not die by suicide. Instead, it is about recognizing that some individuals may face a higher baseline risk due to their genetic makeup. This understanding can guide us towards early identification, proactive mental health care, and targeted interventions that can make a life-saving difference. While genetic predispositions can lay the groundwork, it is often the harsh realities of life that serve as the triggers for suicidal thoughts and behaviors. Life can be a tumultuous journey, filled with unexpected twists and turns that can leave us feeling overwhelmed, hopeless, and lost. Traumatic experiences such as childhood abuse, neglect, or exposure to violence can leave deep emotional scars that increase vulnerability to suicidal ideation. Similarly, stressful life events, such as the loss of a loved one, job loss, financial strain, or relationship breakdown, can act as tipping points, pushing individuals towards the precipice of despair. These events can shatter our sense of security, purpose, and belonging, leaving us feeling adrift in a sea of pain and uncertainty. The weight of these experiences can be particularly heavy for individuals already grappling with mental health conditions, amplifying their struggles and increasing their risk of suicide. Societal factors also play a significant role in shaping the landscape of suicide. Discrimination, social isolation, and lack of access to mental health care can exacerbate existing vulnerabilities and create environments where suicide becomes a more likely outcome. Moreover, cultural norms and expectations surrounding mental health can either serve as protective factors or contribute to the stigma surrounding suicide, preventing individuals from seeking help. Understanding the interplay between these environmental triggers and individual vulnerabilities is crucial for developing effective prevention strategies. By addressing the root causes of distress, providing support during times of crisis, and creating more inclusive and supportive communities, we can mitigate the impact of environmental stressors and foster hope in the face of adversity. Section 4. The mind in distress, mental health and suicide. The link between mental health and suicide is undeniable. Mental health conditions such as depression, bipolar disorder, anxiety disorders, and schizophrenia are significant risk factors for suicide. These illnesses can distort thoughts, emotions, and behaviors, leading to feelings of hopelessness, worthlessness, and unbearable emotional pain. When these feelings become overwhelming, suicide can seem like the only way out. Depression, often characterized by persistent sadness, loss of interest, and feelings of emptiness, is one of the most common mental health conditions associated with suicide. The pervasive nature of depression can cloud judgment, making it difficult to see beyond the immediate pain and recognize that there is hope for recovery. Similarly, bipolar disorder, with its extreme mood swings between manic highs and depressive lows, can create a volatile emotional landscape that increases vulnerability to suicidal thoughts and behaviors. Anxiety disorders, which are characterized by excessive worry, fear, and nervousness, can also contribute to suicidal ideation. The constant state of hyperarousal and apprehension can be exhausting and overwhelming, leading to feelings of helplessness and despair. Schizophrenia, a chronic mental illness that affects a person's ability to think, feel, and behave clearly, can also increase suicide risk due to the distressing nature of hallucinations, delusions, and cognitive impairments. It is important to note that not everyone with a mental health condition will attempt or die by suicide. However, these conditions significantly increase the risk, making it crucial to address mental health concerns proactively and provide timely and effective treatment. Early intervention, therapy, medication, and support systems can make a world of difference in helping individuals manage their conditions, regain control over their lives, and choose life over suicide. Section 5. The role of substance abuse. Substance abuse, including alcohol and drug misuse, is a significant risk factor for suicide, often acting as a dangerous catalyst in an already vulnerable individual's life. Drugs and alcohol, while potentially offering temporary escape or relief from emotional pain, ultimately worsen mental health conditions and increase impulsivity, leading to a higher likelihood of suicidal thoughts and actions. Alcohol, a depressant, can exacerbate feelings of sadness, hopelessness, and despair, particularly in individuals already struggling with depression or other mental health conditions. Drug misuse, depending on the substance, can trigger psychosis, paranoia, and impaired judgment, further clouding an individual's ability to think clearly and make rational decisions. The combination of substance abuse and mental illness creates a dangerous cocktail that significantly elevates suicide risk. Moreover, substance abuse can lead to a downward spiral of negative consequences, including relationship problems, financial strain, legal issues, and social isolation. These consequences can further compound feelings of hopelessness and despair, making suicide seem like the only way out of a seemingly inescapable situation. The disinhibiting effects of drugs and alcohol can also lower impulse control, making individuals more likely to act on suicidal thoughts without fully considering the consequences. Addressing substance abuse is therefore crucial in suicide prevention efforts. Providing access to addiction treatment, counseling, and support groups can help individuals break free from the clutches of addiction, address underlying mental health conditions, and develop healthier coping mechanisms for dealing with life's challenges. By addressing substance abuse, we can mitigate a significant risk factor for suicide and create a path towards healing and recovery. Section 6. The warning signs, recognizing the signals. Suicide rarely occurs without warning. Often, individuals contemplating suicide exhibit behavioral, verbal, and emotional cues that signal their internal struggle. Recognizing these warning signs is crucial for early intervention and can be the difference between life and death. While these signs may vary from person to person, some common red flags include talking about wanting to die or kill oneself, expressing feelings of hopelessness, worthlessness, or unbearable pain, seeking access to lethal means, such as firearms or pills, increased substance abuse, reckless or self-destructive behavior, withdrawing from social activities and relationships, giving away possessions, and saying goodbye to loved ones. It's important to note that these warning signs should never be ignored. Any indication of suicidal thoughts or behaviors should be taken seriously, regardless of how subtle or fleeting they may seem. It's always better to err on the side of caution and seek help than to dismiss these signs as attention-seeking or manipulative. If you notice these warning signs in someone you know, it's essential to approach the situation with empathy, compassion, and a non-judgmental attitude. Express your concern, listen without interrupting, and encourage them to seek professional help. Avoid dismissing their feelings or offering unsolicited advice. Instead, focus on being a supportive presence and guiding them towards resources that can provide the assistance they need. Remember, your willingness to intervene could save a life.